use
All
ours to
right,
hold
ask her to stick her tongue out. So what is this type of papilla that's hair-like?
the filiform.
Filiform. And what about the mushroom-shaped ones?
Fungiform.
Stick your tongue. And then what about, you see those large round ones towards the back that form a V? Circumvallate. And then if I turn it to the side, you see the ones that stick out a little bit on the lateral posteriors. What are those called? No?
Oh, the
And do the same thing on the other side.
I don't remember what they're called.
Starts with an F. Foliate.
Foliate. Okay.
Foliate papilla. So remember, those are the 4 different types of papillae that are on the tongue. Okay? So I've checked out the dorsal surface of the tongue. I checked out the lateral surface. What's left?
The ventral.
Ventral surface. So I'm going to have her raise her tongue to the roof of her mouth. Okay? You see the ventral surface. You see how it is vascular. You can see, what is this banded tissue right here?
The lingual
That's
frenum.
That's a
The lingual frenum. Okay? Do you see the sublingual folds here on either side?
Yep.
Now the sublingual folds, what ducts are there?
the chanclas are
Okay,
there.
Did you say chocolate?
Bartholin's ducts? Bartholin's ducts? And where's Wharton's ducts?
And
they're
the,
called
in the
And where are the
center.
caruncles?
Caruncles, that's what I was going for.
Do you see that right there? See how it's like the 2 flaps of tissue forms a W?
Yeah.
And so that's how I remember Wharton's ducts are there. Okay, you see that? It's like 2 round things of tissue on either side
Yeah.
of the lingual frenum. Okay? All right?
Okay.
So, what am I checking for on the tongue?
Like geographical tongue.
Geographic tongue. So if it
Fisher
looks
tongue.
geographic, how does it look?
It's
There's
got like
it's like
patches,
patchy.
Baldness.
Uh-huh.
scallop tongue,
Scallop tongue.
fisher tongue,
It's pretty,
Bifid
it's pretty
tongue.
normal. What about coating?
making sure patient's brushing the tongue.
And then of course any lesions. Remember, it's one of the common sites for oral cancer is the lateral borders of the tongue, right? So while we're looking at that, looking at all of that on the floor of the mouth, I'm also going to do bimanual palpations to feel the floor of the mouth. Now, some controversy with this because some say you can do this with the patient reclined. I've heard suggestions that you should do this with the patient sitting upright because you can miss something because any hard lesion can actually drift back that you end up missing it. I've done it with the patients sitting up. Like I said, I've seen books that have recommended do this while the patient's sitting back. Do you guys have a preference if they're sitting up or sitting back?
To me, it would seem like better when they're sitting up.
Like I said, I've read suggestions that we should do this with the patient sitting up just to not risk the any hard lesions drifting back and then you end up missing it. So since your books have suggested it with the patient laying back and I'm talking about the patient sitting up, both will be acceptable during the competency. Yes?
I have still found siloliths with them sitting back.
And it's still okay. And siloliths is, remember I told you it can be calcifications by the duct area, it builds up. That's what she's talking about. Okay? So now what do we do?
And glands and floor of the mouth.
Hard and soft.
So hard and soft palate. So what are the parts of the hard palate?
Incisive
Okay,
papilla,
and those are those little wave-like projections. And then incisive what?
papilla,
Incisive papilla, so that like round, hard tissue that's right between 8 and 9. Okay,
palatal
what else is
contour,
there?
palatal contour, palatal structure, suture line, soft palate.
Okay, So what is that line that is right in the center?
The palatal suture
suture
line.
Yes. Palatine raphe is that tissue that covers the suture. Suture is where they come together, that's the bone, right? And then the palatine
really in
raphe
there
is the actual tissue that runs along it. Okay? What about, open real big, what about those two little depressions right where, can you guys see that right here? Do you see that right here on either side of the suture line? See those one depression there, the other depression there? What is that called? Phobia. Palatine phobia. And then we go into the
Phobia.
soft palate. Now, are we going to
Phobia.
palpate the
Phobia?
soft palate?
Fovea.
Oh, phobia.
We're just going to
okay.
palpate the hard palate digitally. So you're just going to palpate digitally, and what are we feeling for?
Like any
The height.
the
So
height,
so
the
it could be
contour.
vaulted.
That's right.
So if it goes up,
High.
actually yours is slightly vaulted.
High
Mine
palate
is-
vault.
And then what else are we feeling for?
Taurus
Palatine.
palatinus.
Taurus palatinus or palatine taurus. Remember, it can go by either name.
Petitia. Petitia.
Petechiae.
Petechiae, we're checking, especially in the soft palate area for any petechiae. And remember, that's one of the things that we look for child abuse, making sure that that is not present. And then